It was really great. Okay, we're good. We're on YouTube. Okay. Very good. So we're all set. Okay, hello everyone. Dr. Rich Castellano here. We're here today with Carol. Thank you, Carol, for letting us share. Carol is doing some full face filler treatment, and we're going to zoom in a little bit there. And so she looks so good. She does not look her age. She gave us permission that we could share. She's 60 years young, and she's looking good. Of course, we always look our best when we smile. Carol has a big power of smile. She's a great smiler. So our goal is we just want to fill some of these hollows that we get. If we're lucky, aging keeps coming for us. So that's what we're going to do today, is fill some of the hollows. And what I did is I did some of the markings. I used a white pencil for that. I'm going to do some additional cleanse to the skin. And I used the lidocaine with epinephrine to do a little bit of numbing, little pinches. Most people tolerate the pinches very well. And Carol does well when she goes to the dentist's office. Carol is very experienced in hypnosis, and so she's good at calming herself down. And I'm going to use some of the Hibit Cleanse, the orange, in through here so you can see that cleansing solution. And we're going to do a little bit more cleanse through here. Carol, do you mind if we ask what was it that inspired you to do a cosmetic treatment?
My girlfriend said, I've noticed you have a little bit of a gobbler neck, and so do I. Do you want to go get it fixed?
There you go. All right.
I said, oh my gosh.
You came out to one of our seminars.
Yes.
And how was the seminar?
It was fun.
Awesome. I'm glad you had it. We do have a lot of fun at our seminars. Did you get a chance to go through our book?
I did.
What did you think about the book?
I thought it's a great idea to have a book out there that explains and shows pictures.
Good. I'm glad that you liked it. And so we're doing the fillers today, and then later in a month then we're going to come back and do the tuck. But for today, we're doing the fillers. So thank you for allowing us to share and teach. So if you're on Facebook or YouTube, please do follow us on Facebook or YouTube. Hello, Nina. Thanks for checking in. And so now what I'm going to do is I use the 1% lidocaine, and then I use this little buzzer device because the brain can only focus on so many things at one time. So here's our numbing medicine, and then the little buzzer device. So you feel buzz, and then you feel a little pinch on 3 here. 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad there.
Fine.
She's great. Carol is so good. 1, 2, 3, pinch. And we were talking about, hypnosis techniques and how fun it is, and the hardest thing is you feel pinch, 1, 2, 3, pinch, is that most people are already so hypnotized in what they're doing. It's hard to break that pattern. So you feel buzz and then pinch, 1, 2, 3, pinch, because we're going to do some of the back of the jawline. And now, Carol, if you need a break, you let me know. I'm not in a hurry. Pinch. So what I found is if I do a series of these little tiny pinches, this numbing medicine. Hello, Laura. Thanks for joining in. Most people tolerate it very well. Pinch. Some rarely I'll have a patient that they do need like Valium or some relaxing medicine before we do the filler. Carol, you doing okay, dear?
Great.
Very good. 1, 2, 3, pinch. A little bit of numbing. And if they tolerate these little pinches so easily, then after that the rest is a piece of cake. So, and we give our patients, Carol had some ice and she was icing her skin. Pinch. So this is 1% lidocaine with 1 to 100,000 epinephrine. Pinch. For the doctors and the nurse injectors, 1, 2, 3, pinch, that are watching on replay or watching live, please make sure you check out our website, Practice Profitability MD. We love to share, 1, 2, 3, pinch, how we do our business practices. We love to teach other doctors what we do because it makes such a big difference in taking good care of your patients. 1, 2, 3, pinch. Because I know when I first started my practice, I was not good in the business, and it does impact your patient care if you don't know how to run things. Carol, how are you doing, dear?
Fine.
Very good. Hello, Roger. Welcome back. Pinch, 1, 2, 3, pinch. So we're talking about how we do long-term fillers in the face. We've done a combination of Sculptra, we've done Bellafill, I've done Radius, we've done hyaluronic acid. The hyaluronic acid and calcium hydroxylapatite fillers, they tend to last about, calcium hydroxylapatite and hyaluronic acid can last a year, maybe 6 to 9 months, and some people have said a year and 3 months. Pinch. Longer term fillers like Sculptra and Bellafill are much more popular because you feel a little bit of a pinch here. Not too bad there, Carol?
No.
Because people want longer lasting results. You feel buzz and then pinch. So I'm trying to get in those smile lines. 1, 2, 3, pinch. I like to inject while the patient is sitting up because it mimics the natural gravitational pull on our face. As soon as we lay back, then everything gets pulled backwards and you don't see the same anatomy. But we're really just chasing some of the hollows that you see, which aren't too much. Make a big smile for me, Carol. See, that's our model. That's what we want to emulate, the fullness in the cheeks. You can relax for me. Thank you very much. Okay. So what I'm going to do is I'm going to start doing some of the injections. And for Carol today, we are using some of the Bellafill, which is made up of collagen and PMMA. The collagen gets absorbed and replaced by our body's own collagen. So this is one of the long-term fillers. Sculptra is the other long-term filler. And we use both of them. I love using all of the fillers because some patients just have different preferences. So you might feel a little bit of a pinch here. Now this is an intradermal injection. Feel a little bit of a pinch there, Carol?
Mm-hmm.
So that's, each time I inject, maybe I'm doing about 1/10 of a cc, maybe 1/2 of a 1/10 of a cc, 0.05 cc. So you don't want to make things perfect. Result. How are you doing, Carol?
Wonderful.
Carol is a great patient. We're doing very well here. And what I'm going to do is now, so that's about 6/10 of a cc that I've injected so far in the brow and in the temple. I'm going to go through this little area that I went to the brow, and I'm going to go a little higher up through the brow. So you can see here a little pinch there. So that's my cannula right in that area. And I'm going to put a little, maybe about 1/10 of a cc right there. And I keep my finger over top and I can flatten the filler as it comes out. So now, yes, you flatten it, yes, you soften, and I'm going to do a little bit closer towards the hairline as well. Some people don't want to hide the filler by the hairline, but you need to blend it in the hairline to make sure you have a nice, even correction. Very good. Thank you for watching. Thank you for tuning in. If you're just joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. And you can look us up at Practice Profitability MD if you are a cosmetic provider or plastic surgeon that wants to learn how to build your practice, or if you're a patient, go to ImageLift.com and see our before and afters. Come out to one of our seminars. Carol, how are you doing, dear?
Wonderful.
Very good. Do you feel a little bit of a pinch over here? Not really?
No.
So I make the little insertion point. This is a 27 gauge needle, very tiny. Okay. And that makes the little insertion point. There is a tropical storm that's coming through to Tampa, and we're getting some of that weather, and the connection does not seem to be as good on some of the... Hello, Amy. Thank you for joining in. Some of the phones here show that they say the connection is not as strong. Pressure, pinch, pressure, pinch, pressure, pinch. And so I just put a little bit here through the brow. We do hollow. The bony prominences in our face, they erode away. So as we get older, we lose volume. We get a little bit shorter from losing the bony volume. Pressure, pinch here. Sorry, it's a little tender. And again, I'm filling right above the brow, right in through this area. Okay, you can see the tip of the cannula there. I'm putting about 1/10 of a cc in that area. And then I press, and I'm just going to flatten that area some. I'm going to hold a little pressure there. And I like to do a deep massage as well. Perfect. Some patients have no bruising at all, and some patients may bruise for 4 to 7 days. Everyone is a little bit different. A little bit of swelling there. So I'm just going to hold some pressure. It's looking good. Now, as I tell patients, you don't want to taste the chocolate cake before it's done baking. It doesn't taste that good yet, so you need a little bit of time before you see the final result. Now, Carol, I'm going to turn your head this way. That's perfect. Thank you very much. I'm going to do a little bit more in the temple, through here. Perfect. And then what I do is I just try and find my insertion point. I just pinch the skin. And sometimes I have to remake that insertion point. There we go. Little pressure, a little pinch through here. And I'm just threading this kind of subcutaneously through the temple. That's another 2/10 of a cc that I injected. Another 1/10 there, and then one more closer. You need to go close towards the back of the hairline in the temple. Make sure you have an even distribution of the product. I like to flatten it out as soon as I inject it. I like to flatten that area. Very good. Hello, Diana. Thanks for joining in. Perfect. I'm going to be ready for you in just a moment here. Since I'm gone. So now I'm going to do some massage. I like to flatten that area. Let me turn your head this way now. That's perfect. And I'm going to turn you all the way over to your left, please. Thank you very much, because I'm going to do some injection right in the cheek. So, Lisa, you can just hold right through there for me, please. Thank you so much. Thank you very much. Elise is doing a great job, has everything set up perfectly for us. Carol, how are you feeling, dear?
Fine.
So I just make the little insertion point right in through here. Very good. I like to tell patients they can ice afterwards. It certainly can help with bruising or swelling. It's not mandatory. So now I'm using the cannula again. And this is a 27 gauge cannula, soft fill. It has the largest inner diameter, pressure pinch, so there is less clogging. If clogging happens, you can sometimes unclog the cannula, or sometimes you just have to get a new cannula. Big pinch, little pinch, not too bad there, Carol?
It's not too bad.
Okay, she's tough. We try and make it easier than getting a tattoo. Pressure pinch. We're so grateful for our patients. We have the most fun. We have great patients. We love their results. Carol has many active years ahead of her. She's been taking good care of herself. If she tells people her age, they don't believe her, and that's a good thing because she doesn't look her age. Thank you for watching. Please do follow on Facebook, and you can follow us on Periscope, and look up our site, Practice Profitability MD, where we teach our techniques. Little pinch there. Okay. Everything's looking good. I like to hold my finger where I can feel the other end of that cannula, and I'm also directing and flattening that product as we inject so I can control where it goes. I think if you do a flat amount of the filler all through these areas, you really get the most natural and the most even correction. It must look natural, so you want to make sure that no one can figure it out one way or another. Let me turn your head this way. Good, tiny bit of swelling, which is what we expect, and we did some fillers up and through here. So we did this cheek and build out the cheek just a little bit. Now I'm going to do just a little bit more over on this side. And so we've got 1, 2, 3, this will be the fourth one, perfect. And then I'm going to do a little bit more around the back of the jawline and blend in. Perfect. So I like the cannula technique. I think it's safer, less traumatic. Pressure pinch, pressure pinch. And once you do the numbing, it feels a little goofy under the eyes with that numbing sensation, but that is normal, and the numbness goes away in about 30 minutes. Most patients really don't need to take pain medicine after a filler. You can if you want. You want to avoid things like Motrin or Naproxen because it can increase your risk for bruising. So now I'm just threading through this direction here, and then I like to use sometimes a little bit of that shiver technique to just thread through. And when you're shivering the syringe, if you have a tremor, you can hide it with the shiver technique. You just tell the patient, hey, I'm using a shiver technique. Thanks. Thanks. I just need some extra ice. Thank you. Perfect. Thank you so much. But it is a very good technique to help spread the filler very evenly. Okay? Very good. Thank you for tuning in. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa, Florida, and in the Villages, Florida. And I am doing a Bellafill injection here. I use a lot of the Bellafill. I use the Sculptra. I use all of the fillers, really, hyaluronic acid, calcium hydroxylapatite, filling some of the submalar hollow. Little pinch there. Okay. Carol is doing great. She is an experienced hypnotherapist, and so she is good at keeping herself comfortable, and she does very well at the dentist. Like I said, some patients do require Valium. That is very uncommon. My favorite quote from Deepak Chopra, he said he was getting on an airplane, someone asked him if he'd like to have a drink, and he just, pretended like he was very relaxed. He says, "No thanks, I just had one." We can bring that onto ourselves. So Carol is doing a great example of the power of suggestion and using your mind to calm yourself down. And I am desperately trying to teach that to my kids. And they are learning it, they're picking it up, but never a dull moment with the 10-year-old and an 11-year-old in the house. So I like the volume in the cheeks, that's perfect. I'm going to do a little bit more in the submalar region. Hello, Tasneem, thank you for joining. So I'm doing the twist technique to get the cannula in that submalar region, and that way when you meet a little resistance, you can just twist right past it. Very good. Everything's looking good. Now I'm going to do some in the back of the jawline. I might do a bit more just in the submalar region so you can see how the volume starts to fill in. Okay. Perfect. Make a big smile for me and it'll feel goofy. Now relax as best you can. Are you feeling any pain right now, Carol?
No.
Okay, good. Me neither. Okay, now I'm going to turn your head to the side like this. So this is along the jawline. We know the side of the jawline and the back of the jaw. We lose that bony prominence. So now we're just making up for that by filling in those areas. So I've got the cannula that I like to use for this area. And we're back to the cannula here. And you can see that very thin cannula. Okay, so I find my insertion point. I have to pinch the skin to just see where the little red dot is. And sometimes I might have to make that little puncture. But then I go to that spot, thread it through to the back of the jawline. Here's the tip right here. And then shiver technique, and I'm just putting some pressure on the plunger, very safe area, right superficial to the parotid gland. No major vasculature there. You stay subcutaneous. And I'm threading things through, so subcutaneous. Sometimes when you inject, you can even feel a little bit of the filler there. You can just massage it straight down, and as soon as you're done, I like to recommend a 5-minute massage 5 times a day for 5 days. That's a general rule of thumb. It's not easy for patients to remember to massage, so just give them something easy to do, and it's not the end of the world if they miss on that, but it's preferable that they do the massage to. If you feel a firm spot or a bump, you can often massage that down. It's uncommon that I have to use the 5-fluorouracil. Everything's looking good. Carol, are you doing okay, dear?
Wonderful.
So we build out a little bit of that jawline. Perfect. I'm going to have you turn your head this way to the side. That's good. And we'll do a little bit more for the jawline, then we have a little bit more to go, and we are done. You're doing great, Carol.
With massage, does it matter which fingers you use? And you
the whole hand?
Whole hand.
Yeah, you can pinch and knead, so I'll demonstrate that. Okay. So you can pinch, push up, down, side to pinch sideways, pinch up and down, okay. Push up, push down, in a circle, counterclockwise, clockwise. You can't hurt the filler, so okay. Just pushing down, up, down, side to side. I think it's all very helpful. Okay. Now I'm going to make an insertion point along the jawline here. Perfect. Okay, now what I'm going to do is perfect. So I thread the cannula back, and you can see I've got it back here at the back of the jawline. So I use both hands to inject. I'm a little more right dominant, but I use both of them. and I can guide that cannula and just put a little 0.05. And when I need a little bit more finesse, I use my right hand there. That's perfect. Perfect. Little 1/10 of a cc here, 0.05 cc's. You split it up, you go nice and evenly. And when you're putting little tiny threads of filler down, it is very difficult to create an unnatural appearance. So you must keep it looking natural. So you feel a little bit of a pinch through here, Carol. Pressure, a little pinch. And I'm threading that cannula all the way down through here. And then I put a little bit in the back where we know we're going to lose that volume. Perfect. I'm going to do just a little bit more back in through here. Carol, how are you doing, dear?
Fine.
Just a fine amount through there, and I'm going to massage that area. Okay. We have about 1.5 syringes left of the filler to go, and so Carol, can you look straight ahead for me and make a big smile for me, big smile. Now relax as best you can. So she's a tiny bit swollen, but almost ready for the grocery store. And I'm going to do just a bit. I like what we've done in the temples. I like what we've done in the brow. The fillers really are the future. So congratulations to Carol. We did full face treatment with the Bellafill, and you can see in her pictures here where some of the hollows and the size of the cheeks and the shapes of her cheeks. Now you look at her and she's a little more full, as you can see in through here. Let me turn that one down a little bit. There we go. And then that, make a big smile, so when she smiles, she looks natural. If you're meeting her for the first time, she doesn't look swollen. Friends or family might think, hey, you look a tiny bit swollen, but believe it or not, they don't notice it, and then that